stakeholder meeting with you. So we're going to take a deeper dive into this project today. We will be going over select topics that you all raised, not only in the previous stakeholder meeting, but as well as the stakeholder survey to get further feedback on. Next slide, please. Before we get started, we would like to go over our mission here at the department. At HCPF, we're always striving to improve healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. Next slide, please. So we're going to review our agenda for today's stakeholder meeting. First, we're going to begin with introductions and then have a quick overview of the stakeholder survey results. We will then review the current onboarding and screening requirements for host home providers. And following this, we will review the proposed recommendations for onboarding and screening for host home providers. We will allow time for open discussion here to gain feedback on the proposed recommendations. Additionally, we will discuss the current training requirements for host home providers and then go into the proposed training recommendations. Again, we will open for discussion for feedback for this topic. Once the discussion has concluded, we will have time for our vendor joining us today, Mission Analytics, to speak with you all regarding the results from the stakeholder survey and how this will be incorporated into smaller focus groups for this project. We will also touch base on the logistics for our future stakeholder meetings. And finally, we will close with questions. Any questions that we are unable to get to today due to time constraints, please feel free to put your questions in the chat. This will be monitored by our team. Or you are welcome to email your questions to us, as we want to make sure we follow up with you to capture any additional feedback. Next slide, please. So moving into introductions, I will go ahead and introduce myself. My name is Victoria Rogers, and I am an HCBS Residential Benefits Specialist here at HCPF. Joining me today is our HCBS Section Manager, Cassandra Keller, as well as our HCBS Benefits Supervisor, Meg Yanaba. Additionally, we have Peggy O'Brien and Catherine McCoy joining us today from Mission Analytics, and they will be speaking with us later on in our presentation. Next slide, please. So to begin, we want to thank you all who contributed to the stakeholder survey provided in our last stakeholder meeting. The survey generated a lot of great vital feedback for us to utilize and incorporate into this project. Some of the most popular topics from our survey results were increased accountability and consistency for host home providers, improvement in quality and existing services and regulations, providing training and educational opportunities for host home providers, increased monitoring, increased oversight and protections to ensure health and safety of our members, collaboration between state departments, and finally, balance of punitive measures. These topics will continue to be slowly generated into our stakeholder meetings moving forward for further discussion and expansion. So we encourage you to provide us with your feedback and attendance. Next slide, please. So we will begin by discussing the onboarding and screening requirements for host home providers currently. The current onboarding requirements for host home providers at minimum include background checks, a Colorado Adult Protective Services, also known as a CAPS check, to be conducted. However, these requirements are not always sufficient in capturing necessary information to ensure the health and safety of our members within these residential settings. Program Approved Service Agencies, also known as PASAs, are to conduct a background check on all potential providers. However, there is no clear definition that breaks down what is needed within a background check and the level of investigation required. For example, a PASA could conduct a background check, but due to possible financial constraints, they may only conduct an internet name check or a very basic background check that could leave out vital information for PASAs to be aware of, such as previous arrests not only within the state, but in other states as well. CAPS checks will continue to remain a requirement for all providers to undergo when attempting to onboard with a PASA. The difficulties we have seen in the past and currently regarding CAPS checks is that it may not display offenses a provider may have in different states as it relates to mistreatment, abuse, neglect, and exploitation, also known as MAIN. Ultimately, PASAs continue to maintain the ability to choose different types of background checks, the levels of background checks, and what they consider to be prohibited offenses. PASAs may have different requirements and standards in comparison to other PASAs throughout the state. Without consistent minimum requirements in place when onboarding a new host home provider, this may pose complications for the PASA when attempting to recruit if a PASA has lenient or even more strict requirements in comparison to other PASAs. Furthermore, without consistent requirements, this could also jeopardize the health and safety of our members. Next slide, please. So with that being said, we'll move into the proposed onboarding recommendations. The department is proposing that background checks will continue to remain a requirement for host home providers. However, we are looking to incorporate fingerprinting that will allow a search not only beyond the state of Colorado, but will allow the PASA to see any possible Maine-related offenses in other states that a CAPS check just might not be able to capture. CAPS checks will continue to remain a requirement for host home providers. Should that provider fail a CAPS check, that provider will be prohibited from rendering HCBS services to members. Next slide, please. So the department is also looking to include department motor vehicle checks, as we feel that this could be beneficial for PASAs. This could allow the PASA to validate a couple of things. One, to see if the provider is insured. Two, to see if the provider has any outstanding infractions. And three, to make sure that the provider is also maintaining a valid driver's license. This will ensure that the provider is reporting any interactions they may have with law enforcement that could result in citation or even arrest. The imposed recommendation will ensure the health and safety of our members while being transported to a variety of community activities with that host home provider. Recommendation for this imposed measure would be when the provider is initially onboarding, as well as every 3 years following that. And finally, the last proposed recommendation for onboarding a potential host home provider the department recommends are professional references. The department feels that this would assist in the quote-unquote PASA hopping issue, as the host home provider would be required to provide professional references from most recent employers as detailed on the provider's resume. This will allow the PASA to have an overview of the provider's employment history, as well as skills and abilities. The PASA will continue to reserve the right to proceed with the provider. However, this would be an assistive measure when vetting providers and initiating a provider contract. Next slide, please. So with that being said, that concludes our first topic for this presentation, and we want to hear from you all. This is a discussion with you all so that we can get your thoughts, as well as feedback on what agencies currently have in practice, such as the level of background investigations that you all conduct within your agencies. We also want to know what your thoughts are about the fingerprinting. Do we think this would be beneficial? Are there any difficulties with this option or recommendation? Also, what about the department motor vehicle checks? We want to see if this is an excessive measure. We also want to know how this would benefit your agency and members. Would this also provide you a level of comfort and confidence when working with a host home provider? We also want to hear your thoughts on the professional references. And if you do not agree with these recommendations, what recommendations are you able to provide us with? So trying to see, I don't know who had their hand up first, but you are welcome to come off mute and share your feedback with us.
This is Shanda. I'll just go ahead and hop in here. This is Shanda McLaren. I'm with Integrated Life Choices, and we do a federal check. We have the 3 professional references. We do a lot of these things already. 2 questions. One is, I know that when we've had neglectful or abusive situations and have terminated, substantiated the abuse or neglect and terminated a provider, there is something that we report to HCPF and let them know, what occurred. And my assumption was, or I guess what I thought was supposed to occur, was that they were to go on a specific list so that other PASAs couldn't pick them up. And what we're finding is that other PASAs do pick them up as host home providers. And in some instances, they've even been able to take an individual that we through our agency and take them to another PASA. It's really concerning because the issues are really concerning. So I guess one of my questions is what does HICMA do with that information? And is there any chance that that could be a database that PASAs could access, I guess is my question. That's my first question. And then my second is just on the fingerprinting thing. We do essential screen. It's a background agency. It's done federally. We don't do fingerprints. I just want to give you my experience. I'm from Nebraska. We used to do fingerprints there, and it really, really delays the process. It's really not very functional. I do think requiring a federal background check is very necessary. And if you go through a reputable company, I think that that's done. But I don't agree with the fingerprinting just because I don't think it's going to make the process very easy. So, or there you go. That's the
Sure.
So hopefully that wasn't too much. Thank you.
No, not at all. Thank you so much for your feedback, Shanda. I'm going to let Cassie speak to your first question.
Yeah, Shanda, I appreciate that question. And I think that this has been one of the most challenging pieces that we have been trying to figure out how to utilize and implement since we revised these regulations several years ago. We do collect that information from you about terminated providers. And in some instances, we have notified other provider agencies via email to say, we do think this would be something that this direct care provider, this host home provider is somebody that, you may want to consider when if you're going to employ this person. The challenge that we've come across is that, and when we've, I think someone from the Alliance brought it up last time, is really trying to also include due process. You have said you've terminated this person. It's really hard for us to put them onto a public list that says, don't hire this person, and in infringing on any future employment opportunities they have within this realm. So we're trying to balance kind of due process for an individual to say, it could be a one-sided thing that why this person got terminated, and then protecting the health, safety, and welfare of individuals. So we are working with the Attorney General's office to try and navigate that, come up with a process, how we can notify prospective PASAs of this individual that has been terminated, what kind of offenses rise to that level. So definitely something that we're trying to figure out, but I appreciate you elevating that. I'm just going to go down the list of folks I see with their hands raised. Christy? Not seeing Christy come off mute. Let's skip to Elise for a moment.
Oh, I'm sorry, I pushed the wrong button. I thought I took myself off mute.
Go ahead, Christy.
And I just lowered my hand. I'm so sorry. So I've got a question about kind of the scope and the focus of this group, because the bill that was passed identified three primary things that had to be looked at, which were grievance and complaint process, filtering out people who have been convicted of abuse, and consistency of contract language. So I'm wondering when we're going to talk about those things.
Good question. Thanks, Christy. I think we will. What we were trying to, there's a lot of things that not only have been brought up in the bill, but brought up to our attention of ways in which we need to address the safety of host homes. And so we are trying to kind of piece by piece work on these pieces. Specifically, Mission Analytics is going to talk in a little bit about what their focus is going to be, and the grievance process is one of those larger parts of what they're going to help with. So we do plan to kind of get to lots of these things, but we wanted to start with what felt like perhaps maybe a lower hanging fruit and easier topic in terms of onboarding and requirements for those host home providers. Elise, do you want to go next?
Yeah, thank you. Just real quick, a couple things regarding those couple of slides. FBI, Chandra, we do get the FBIs really quickly now, but the cost is much more than our CBIs and CAPs, right? So a FBI for one adult is just under $60. So we really need to take that into account, because if we are doing that for all our host home providers, it's going to be a much a bigger cost on the agency. So I just want to be aware of that. And I also want to make sure that we are using the correct verbiage, that our host home providers are contractors and not employees. So it's hard to ask for professional references. I will say we ask for references often on all our applications for host home providers, but I will also say that oftentimes they do not put agencies that they have contracted with before, because they don't want us oftentimes asking. Sometimes you do, sometimes you don't. So I would say that the majority of the PASas that are at least on this call are already asking those questions. So I don't want to lean towards children's foster care for host home, because we have a lot of barriers there. But one thing we do have is the Trails system, where we can log in and see who they're certified with already, or if they've been certified in the past for applicants. So something to that, course might be beneficial as well, but it'd be a much bigger ask of the state. That is all.
Thanks, Elise. I think the assumption was for a lot of the providers here on this call today that you were already doing all of these things. You are doing these kind of background checks. You're doing all of these really beneficial parts. But there are absolutely PASas out there that are not doing really any of these things. So wanting to standardize that, but also trying to understand what is going to be cost prohibitive. I think $60 for an FBI check is not going to fly. So how can we kind of come into a middle ground of increasing the oversight without going so far that you're not going to be able to get any host home providers, or you can't do it under your existing operations. So,
well, and we run in that in Montana, just real quick. Montana certifies host home providers just like children's foster care. And within a year, I have 2 people that I've been able to develop there, because it's such a hard process.
yeah.
So just keep that in mind. We don't want to lose host home providers in order for this.
Absolutely. Jody, go ahead.
Yeah, thank you. So I want to start off first by, I think it is a great idea to set some minimum expectations that background checks need to include both a CBI and an FBI check. I do think, however, those being electronic checks and not necessarily fingerprint checks is an important distinction. And I also just wanted to point out that there was literally within the last week a 9-page operational memo from the child welfare side of things, operational memo 2023-0018. That went through the complications of being able to share CBI and FBI information with non-state or county personnel, so to the CPAs, that all has to go through state personnel to be for whatever legal reasons. And it's a whole complicated process for whatever legal reasons. So that really needs to be looked into for whatever legal, whatever reasons those are, that cannot be shared with a private entity for the fingerprinting aspect. That would need to increase state FTE in order to manage that process. So in addition to, I think, the $60 per pop fingerprinting cost, there is some sharing complications with the fingerprinting. But I would strongly advocate that if there are PASas that are out there that are not at minimum checking both state and federal background checks, that's a problem. And certainly I think the providers that are on this call today would say that that's a problem, and we would love to see that tightened up and would support that. And in addition to that, I also agree with, we have worked with some individuals that maybe have only had one job, whether that is because of age or because they've only worked at one place for 20 years. 3 professional references could really be a problem for some individuals. We run into that. So having some degree of flexibility in that is important as well, just for circumstances. 3 references is not a problem necessarily, but just individual circumstances are different.
Absolutely. Thank you for the feedback, Jody. We really appreciate it. We'll definitely take it into consideration. Moving on to, I believe, Northcutt, you had your hand up. You might be on mute.
Sorry, can you guys hear me now?
Yep, can hear you.
Okay, sorry. I was just hoping to share with you guys some experience that I have having. I worked in developmental disability services in California, Georgia, and Utah. Currently, am a host home provider in Georgia and Utah. All of the other states that I've ever worked in have required live scan fingerprinting background checks, and all the other states that I've ever been an administrator in have required that the state actually processes a background check and tells you whether or not this is somebody that you can hire and move forward with, and have as a contractor or provider. Really a surprise to me to have to manage that on my own, based on the background checks that I was reading and having to make that decision. I think that it's an administrative burden that they're putting on the providers that is really burdensome, honestly. I will say that my experience with the live scanning background checks, it takes a longer amount of time to vet a provider. It takes a longer time to vet a contractor to see if there's somebody that you really want to work with, because you do have to wait for somebody else to say, yep, this is somebody you can hire. And definitely at times when the state is not processing those backgrounds quickly, it has been hard. And taking that off my shoulders and not having to make the decision about, like, is this something I should be concerned about? Is this, traffic stops? So, like, if they've gotten pulled over 3 times in the last 7 years, I need to make a decision of whether that is somebody that can work or not. Not having to make that decision makes me a lot happier. I don't like having to make the decision based on a background check whether or not this is somebody who should work. I think it is more expensive, like you guys are saying. Yeah, for sure. I think I spend like $20 per on versus right now. So it's a little more expensive for sure, but I like not having to be the decider. So that's my personal experience. And I'll back up the people that are saying about the references. Like, people just don't tell you who they've worked for if they don't think they're going to get a good reference from that person. People just give you the references that they want you to hear from, and my professional references can be wishy-washy at best. So that's just my point of view. Just wanted to share that.
Thanks for sharing that. I appreciate your experience. I think one of the hard parts, and I'm seeing some of the chats, so we're not ignoring that. I'm seeing some of those come in about potentially having some kind of list of prohibitive offenses. I will say this was a challenge. That is a really challenging thing. It was a hard thing when we came up with CAPS offenses that would prohibit someone from working. And I'll tell you, listing off various offenses that would prohibit or preclude someone from working in this field is really hard. So if there is an existing list that we could kind of work from, I've seen this in our consumer direction program. There's a barrier crimes list. I know CDPHE, the health department, has had struggles with trying to come up with the list. Northcutt, you're saying, like, that's a hard thing that you don't want to do as an agency. that's really hard for us to also put that in place. I think if, you know, if you guys have a starting place or something that you use as an agency and we can come together and maybe come up with that. I think that's a good idea. It's just it's a lot harder to land on those things than one would think. And then I want to go back to those that have their hands up, but I also wanted to know how folks felt about the DMV check as well. Sounds like fingerprints are pretty prohibitive. You know, that's great to hear, but running on a federal and a digital CBI and FBI check, that sounds good. So Shirley, let me hand it over to you.
Okay, so just a couple of things. One is that, I mean, I really feel like this is a good conversation that we're having. I think it's a useless conversation if we do not have some minimum requirements of, like in foster care, if somebody has something pop up on either their background or their criminal history, like, I don't know, domestic violence or, you know, abuse of a child or something, that would be called a must take, meaning we have to take action, meaning we can't certify that home and we can't place in that home. And that's for the safety of children. So unless we have like a hard line that we can say, these are the items that absolutely not be tolerated in order to care for vulnerable adults, then we will still have the issue of host home providers migrating. So if they are substantiated, for example, and that comes up, then they can just migrate somewhere else and the individual can choose to go with them. Choose, I say, and then they're gone and they're still providing services. The agency has lost, you know, someone that they serve. The agency has lost revenue because this person was allowed to migrate and with serious concerns. So I feel like this conversation's good. And I also feel like unless we can come up with some hard line items that says HCPF will not fund a host home provider's, you know, the Medicaid billing for this individual in this home for this reason. That's what I would say needs to happen. And then the other thing is I am hearing some people say that they are doing a FBI check. And I am wondering how, because the legislation that's passed for providers to be able to do a FBI check is for children only. And it's not for the use of any other purpose. I know that when I first started, I thought, oh, we have this great avenue, you know, we can do this, but we really can't. And it's for the purpose of privacy, etc. So I'm just going to throw that out there. I don't know if I was accurate in hearing that, and I am curious to hear what avenues or what agencies people are using for the CBI check. We do the online check, and it is the Colorado background check, and we get a release of information signed from them. But we also require the 3 references, and in general, I would say that we get them. It might be, you know, delayed or whatever per their, you know, their own timing. But we also, for the purpose of cost, because they're a contractor, we don't do this with our foster parents, but because they're a contractor, we have the host home provider pay for it. So they pay for their background check and their DMV check. And we do it annually. We do both annually. So those are my thoughts. And then my question is, you know, hopefully, and is this group going to look at some hard lines of saying, you know, we can't fund homes that have these charges that have been not only, you know, like you can be charged with it, but then, you know, we can see that they were substantiated or found guilty of it.
Thanks, Shirley. I apologize for cutting you off a little bit. There's several hands raised and we have a couple more topics to get through. I don't want to cut anyone off from having a chance to speak on this subject. So I have 4 more hands raised. If you all could try and limit to like 1 minute apiece, and then there's also time at the end. So I'm going to hand it over to you, Zachary.
Sure, thanks. I'm here. I've been asked to be here on behalf of the elder law section of the Colorado Bar Association. Just had a comment there, and Jack Johnson I see is part of a working group there relating to new uniform law that's being proposed. Right now, when folks apply for guardianship and conservatorship, they're not required to provide a federal background check, and there are certainly privacy limitations around both what comes back from the Colorado Adult Protective Services Registry and also the CBI check that's done. I'd be happy just to send over the privacy regulations that exist in the context of protective proceedings, which are adjacent, I think, to what you're doing now, so that you can see what the judicial branch is doing.
That'd be really helpful. Thanks, Zachary.
Yeah.
Cindy.
Thank you. At Continuum, we do the motor vehicle checks annually. Background checks, we did annually. We do them every 3 years at the provider's cost. And then we do background checks. I don't agree with the 3 professional. It worries me that you're bordering on employee. There's a difference between the employee and the contractor. The other thing I would like to point out is we have to put in, is it monthly or every 3 months, the list for the housing of who the provider is and what individuals they have. Is there something that can be incorporated in there, where there could be a list of providers there? So, I mean, we have the list, right? But if somehow we could tag that with a provider that's been termed. So if we termed a person for not an APS substantiation, but something we substantiated, can't we put that in there somehow that we termed this contract and others could see it?
I like that idea, Cindy, trying to leverage that system. Thank you. Ani.
Yeah, thank you so much. I think from an advocacy perspective, absolutely agree with increasing a higher scrutiny when evaluating potential independent contractors as host home providers. Can you talk a little bit about what the discussion has been internally around monitoring and oversight of any real current regulations, including increased regulations? We have heard that the PASAs on this call are doing all the right things. So what would we do and how would we evaluate when some of the bad actor PASAs are not actually clarified to move forward with some of these independent contractors? This continues to be an area and concern where we have folks that are doing work that should not be doing work, and there is no system in place to catch those bad actors and then to building consequences for that PASA.
Sure, good questions. I think Maureen says that CDPHE doesn't do a good job with PASA oversight. I mean, I think we have that as our main mechanism. We contract through our interagency agreement with CDPHE. They do the oversight there for us. I think the challenge, when we've heard through this legislative process that there needs to be more boots on the ground, people inspecting and being in the homes of individual host home providers. I think the challenge becomes very, very expensive, and HCPF certainly doesn't have the staff. And if we were to get that staff, it would cost a lot of money to have that many folks to do that. So, I mean, we are certainly open to some suggestions on how we could better leverage and increase that oversight. Obviously, if you have provider agencies that are not following the rules and you just layer more rules on them, that's more rules for them not to comply with. So we are certainly trying to increase that with additional we are in the process of, there's a couple of providers getting terminated. We are really trying to we are taking that seriously. We are working with our partners at the health department to make sure that some of these provider agencies that are not following the rules are no longer in operation. We also have some initiatives. Mission Analytics is actually helping us work on that, and we'll get to that in a few minutes, is that really trying to help providers on the front end before they become enrolled better understand what the expectations are, better understand what it means to be a PASA, and making sure that kind of they're starting out on a better footing. And so, you know, I don't have any really good answers aside from CDPHE. I know folks don't think that they're doing a good job, but those are that's currently what we have. And so without adding lots more people and lots more money to this, I'm not sure how else we, you know, increase that oversight. Certainly by no means the end of the conversation there. I want to hand it over to Steve, though, before we switch topics.
Thank you. I wanted to quickly share an experience with the CAPS check that helped shed some more light on hiring individuals that had a allegation. So I had to go back and forth a couple times with behavioral health. I finally got a response from Jane Flournoy. She referred me to the 250510 8.609, and it gave me clarification because we were in the process of looking at a direct support for day program who had a minor severity level CAPS. And so it talks in that section about the severity levels, what's allowable, what's not allowable. But I had to go through another representative before she passed me on to Jane. So it was difficult for me as a PASA to find exactly what those regulations or guidance is, and then it leaves it to us to hire or not hire. So I think the CAPS checks work and it's successful, and there is some guidance on what severity levels are allowable to hire. So I think that there is a process in play that works. I think the question is how do you enforce it now? But that was my experience. I think it is successful. I think more providers may need to be made aware about what is allowable, not allowable for those hiring.
Great, thanks, Steve. I know we're not reading through the chats, but that doesn't mean we're not seeing them and utilizing them, you know, as we work through some of these things after our conversation, kind of more brainstorming. Yes, Christy, go ahead.
Yeah, I wanted to comment on the cost and the need for boots on the ground for some of the surveying processes. And one of the things, I mean, the model that CDPH&E uses is really one of being on site. And it seems like they could do a desk audit or a desk review of some of these practices remotely, without requiring the travel, the time that it would take to do an on-site review, and to do a larger sample size to ensure that people are complying with regulations. I think Ellen had put in the chat a comment about the survey selection process that CDPH&E uses primarily identifies the same host home providers every single time. And so I think it would be in HCPF's interest to be a little more specific in their contracting with this provider on how they actually select the sample when they're doing those surveys, and to maybe look at some different survey methods to catch some of these things. Because again, we hear a lot about how the vast majority of providers are good providers and do all of the right things, and it feels like HCPF's sort of throwing their hands up in the air saying we don't know how to identify the bad actors.
Thanks, Christy. I'm going to go ahead and hand it back over to Victoria to lead us into our next discussion.
Thank you, Cassie. If we could switch to the next slide, please. So thank you all for your feedback and for that robust discussion. That's the purpose of these stakeholder meetings, and moving forward, these are going to be ongoing discussions that we want to have with you all. So like we said earlier, we are still paying attention to the chat. We will take down your questions and follow up with you as soon as possible. We will also have time later on for questions. And again, if we do not get to all your questions today, you're welcome to follow up with me via email after this meeting. So moving on to our next subject, we want to discuss with you all the current training requirements that are in place for host home providers, as well as the proposed recommendations that are being made on behalf of the department. So currently in place, host home providers are required to be QMAP certified if they are assisting members with any medication management. Providers are also to be trained and oriented on the members' activities of daily living, their rights, and individualized member training. Additionally, providers are also trained on abuse and neglect prevention, reporting of MAIN, as well as person-centeredness. Next slide, please. While the department feels that the training discussed on the previous slide are necessary and will remain a requirement for host home providers, there are also additional trainings that the host home provider could benefit from with continuous training and educational opportunities while serving HCBS members. Additional trainings that are being recommended are 1, a provider orientation, 2, incident reporting beyond MAIN, 3, human rights committee and rights modifications, 4, provider roles and responsibilities, 5, behavior training and de-escalation techniques, 6, HCBS waivers, individual residential services and supports, also known as IRSS, rules and regulations, and 7, HCPF, the Colorado Department of Public Health and Environment, known as CDPHE, the Department of Local Affairs, also known as DOLA, compliance and oversight. As you can see, we have made designations for the entities that would be responsible for providing these trainings, as well as ensuring compliance with renewal of training as applicable. Incorporating these trainings would allow an opportunity for host home providers to become familiar with the HCBS world, as well as ensuring training is adequate in serving our members, especially for new host home providers that are unfamiliar with these services. Furthermore, it could also be a benefit to the PASA and the host home provider to have an understanding of state rules such as HCPF, CDPHE, and DOLA, and how they play within these services to ensure compliance and to avoid disruption of services. Next slide, please. So again, we're going to allow time for discussion pertaining to the proposed training recommendations and any feedback that you have for us to take into consideration. Again, we want to hear from you all on what you think works, what doesn't work, what your agency currently has in place, how members and families feel about the training. Is this sufficient? Do host home providers feel like this will prepare them for performing well within their roles? Did we miss anything? So any suggestions and comments, we will open it up to the group at this time. So let me take a look. Cindy, I believe you had your hand raised first. You can go ahead.
There are a couple concerns. So they already have rules about needing training specific to the individual. So if the individual requires any kind of hands-on, you're required as an agency to have the provider trained. Making everybody go through behavioral training and de-escalation. My only concern is having everybody trained on a hands-on. If they don't need it, I think that opens it up to people doing restraint when they may not need to do a restraint. Having the rules and regulations for a provider, I think you're overloading them a little bit with that. We have given them out and we review them during our meetings with providers, but I think that may not be great. And I don't know, I think CPR first aid would be one that I thought was a requirement. That's all.
Thank you, Cindy. Let's see. I don't think anybody else had their hand raised. If you're wanting to come off mute, you're welcome to do so. Otherwise, we'll take a look at the chat to see if there were any other questions for this topic.
This is Julie Riskin. I have a suggestion. There's nothing in here about like ableism or, you know, understanding like the basic rights of people with disabilities. It's all very rules related and nothing about understanding us and how, you know, just kind of how to interact with us or understanding that like we might want to have a life. I have a client who like has had like no social interaction in a host home for like 2 years. And it just seems to be like, well, if they're not being abused, everything's okay, and nothing about skill building or having any kind of, you know, participating in something like Special Olympics or something that which they want to do. So I'd like to see some kind of training on that.
Sure, that's great feedback. Thank you, Julie. Jody, you had your hand raised.
I may have zoned out for a minute and I apologize if I did. Is this additional training recommendations or instead of and the only training recommendations?
So the first slide went over what's currently imposed for providers. The second slide is in addition beyond what's in regulation.
Got it. Thank you.
You're welcome. Shanda?
I just wanted to say that we already actually have all of those. We have our rights and responsibilities. We have all those trainings, and we also require family caregivers to do it equally as an employee or another contractor. But I do like the idea of making them a little more familiar with what our role and responsibilities are. Some of those HICPUF things that were added, I do think would be helpful.
Perfect. Thank you, Shanda. And we'll probably have Laura speak and then Zachary, and then we'll need to go ahead and move on to our next topic. Laura?
Thanks, Victoria. Just one quick, I very much appreciate that HICPUF is putting themselves out to help PASAs in some training topics. I think that's really great. I think that's beneficial. I think the more people who are training, the better, especially when you don't just have one trainer. It can be hard to listen to that single person. One concern I have, though, is before any of this, I would feel comfortable really supporting this going into rule, would be understanding exactly how HICPUF is going to implement this. So is this going to be live trainings people have to travel to? Are these recorded? Is there a testing component to it? How often are they offered? Really understanding, you know, if the class was yesterday and it's only offered once a month, and then all of a sudden you're super delayed trying to get somebody onboarded. So just really understanding what that structure would look like from HICPUF. But again, really appreciate that the department is putting forth the offer to help in that training.
Absolutely. That's great feedback, Laura. And we would be looking towards an online platform so that it's still accessible for everybody. And like you were saying, if they miss one in person, then, you know, now they're without that training. So we totally agree. And thank you for your feedback. Zachary, if we could have your feedback and then we'll go ahead and pivot.
I'm sideways. That's great. I don't know why that is. I don't know how anything works. So let me just, there we go. To the point about, socialization, I just wanted to, from what I thought I saw in a prior slide, is that part of the training right now, it's always been my understanding, is that there is training on the rights of the person receiving host home services under 25.510 Part 10 Article 2, and specifically the right to communications and visits. And am I misunderstanding that, or is that in fact part of the current training regime?
Cassie, would you be able to speak to that one?
I'm gonna admit I was doing something. So Victoria, can you rephrase with the question?
No, that's fine.
I'm sorry, Zachary.
These conversations always, it's you like flashback to COVID and all the litigation that was happening there around rights to communications and visits. But to just pick up on Ms. Riskin's point, I just wanted to confirm that the training right now, it's always been my understanding that it covers the recipient's rights, the basic rights under Title 25.5 Article 10 Part 2.
So generally, I think that, HICPUF doesn't go into great detail about what kind of trainings or what the content of the trainings are, but there's trainings into the, as I can't remember who said it, but the needs of the individual. Members' rights are outlined in a regulation, but I don't know that specifically what your rights are as a member of Medicaid. We don't go into that kind of detail. That's not required, I should say. So I think that's one of the things probably that would be helpful is here are what your rights are. Here's where they're outlined in regulation. If you need a modification to those rights, or if there needs to be a modification to those rights, here's what that process looks like.
Yeah, and I'm happy to send out another email on this. I know that when I'm representing a nursing home or a hospital, there are major requirements about posting rights and notifying recipients of the rights that they have in that context, and that's a pretty frictionless thing. It's a very low cost thing that I would think could be implemented in the host home context. That would go a long way.
Okay. Thanks, Zachary. Shirley, if you could, we're going to have to skip you, and I apologize. If you could put your thoughts in the chat. We need to turn to our last topic and our guest mission analytics. So, Victoria.
Yep. Peggy, if you are on, I will go ahead and have you present your slides. And we're going to allow Mission Analytics to present and speak with you all regarding the topics that were mentioned in the stakeholder survey and how those will be incorporated into smaller focus groups. Peggy, it's all yours. Hey, if you're speaking, we can't hear you.
Okay, can you hear me?
There you go.
So Mission Analytics is really going to be serving like as a research assistant, I would say, to HICPUF on supporting this. So what I wanted to do was just kind of introduce us, and since you're going to potentially be hearing from us, and we'll be taking out a lot of the things that we've been hearing today and that were in your survey before. So I just want to say, so we are a small business, but we really focus on long-term supports and services for people with IDD. I have worked for more than 20 years with the California Department of Developmental Services. We also work with CMS. We are part of the team CMS that enforces the settings rules. So we're doing some of the site visits on setting compliance. We also work with the Administration for Community Living. We've worked with HICPUF for about 10 years with a number of different stakeholder groups, including the Community Living Advisory Group. There's a Models of Care stakeholder group. I have done work specifically looking at the critical incident reporting rules in the Colorado waiver. And we're currently working with HICPUF on some other projects, including self-directed services. But also one of the things that you heard specifically, Cassie mentioning, this improving survey and certification. So for example, that comment about sampling is one of the things we've talked with CDPHE about, and I've already forwarded that comment onto our team that is working on some of the implementation and work plans for that. So I've mentioned I've been working in this area for a long time. The other lead person on this project is Kathy McCoy, who's also on the call. We have in California what's called regional centers. They're really the equivalent of CCBs, so not what you guys call regional centers. So Kathy comes out of that world starting as a service coordinator, case manager, but also has done a lot of vendor oversight, and in California helped close the developmental centers. So, really involved with making sure people get inclusive and safe care in the community. So just in terms of this contract, one of the first things, there's 6 major tasks. The first one is, as I said, we're sort of a research team to support you guys on this. So we'll be looking at we're currently looking at what oversight requirements are in other states. So when you've given suggestions, like on Nevada's rules for what counts as convictions, Utah, Georgia, we're looking at those things, and as ideas come up here, we will check how commonly these are going on in other states, but also if there's ideas coming from other states that they do, we will share back with HCPF and with this group. And also, there's been in the chat a lot of questions about the certification and licensure. So that's one of the things we're looking at also in other states. What are the relative roles of the state oversight agency, the case management agencies, host home agencies, and the host home providers, and sort of where the different requirements land. We're also going to be looking at the certification inspection data, so the things that are coming up in terms of any complaints as well. And incident reports. We recognize that this is only sort of the tip of the iceberg, again, not necessarily the issue for the good providers, the good agencies, but if there are particular themes that we see in that, we want to make sure that this look at the regulations addresses those kinds of things that we're seeing. One of the things that we can do is if this group has any special topics that they would like us to pursue, we can go and do research on that. So, anything that you want a little bit deeper dive, we can also help on that. And then finally, in terms of the meat of this, as Victoria mentioned, we will be doing separate focus groups. There were at one point 130 people on this call, and obviously lots of people with opinions who have not been able to share those. We want to talk separately with different constituencies. So, recognizing that there's different trade-offs and making sure all of those groups are heard. So we'll be following up to do focus groups. They'll be, on Zoom, virtual, with individuals and families with lived experiences, host home providers, host home agencies, CCB case manager representatives, and advocacy groups. And I see in the chat a question of how we get into the focus group. If you want to volunteer, definitely, put it in the chat or send an email to Victoria and Meg. We're certainly would love to have an easy set of people who are interested in talking. So that would be great. And then we've talked a little bit about the grievance procedure. That's one of the things that is called out specifically in the legislation. So we'll be looking specifically, not just at what those procedures are, but is there a way of having more plain language support materials to support that process. And then finally, we'll be helping on whatever kind of the final report comes out of this process. So in the interest of time, I ran through that really, really quickly. We are underway with the environmental scan. We'll be doing more of that. The focus groups will start after the beginning of the year. Certainly open to any questions that anybody has. Ellen, I see you have a question.
I do. I think my video is taking a second to start back up here, but as long as you can hear me.
We can hear you, yes.
Okay, good. One of the things that we've heard pretty consistently from members, and I'm assuming this will come up in your research of other states, is that there seems to be a general interest that there's some way that problematic host home providers can be blocked from providing services across other 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 PASAs. And I know that, Cassie, you touched on it, you know, you all have that internal list, and the due process concerns are a major issue that's probably going to require, you know, some type of additional financing, but it'd be really interesting to know what kind of processes exist in other states. So I just propose that as a topic for your research.
Great, thank you. Shirley?
I just want to say that I think I'm going to echo Ellen, and I had touched on it earlier, which is what is HICPUF going to do as a result of these work groups as far as not funding homes that have been identified as a risk for individuals, to stop that hopping from agency to agency. I'm just going to reiterate that because that is a long time concern. And I think that it's the only way at this point that we will be able to address the issue as it stands. Is there's got to be a barrier when somebody is going to leave and take somebody with them that's vulnerable and really can't make that decision alone. So I just am looking for HICPUF to help us with that. Thank you.
Maureen?
Yeah, this is Maureen. I was just going to say the IDT teams, interdisciplinary teams at the community center boards, are supposed to serve as a checks and balance, but they're really not working. So I think that some of the existing structures that are supposed to provide some of that cross-checking are not working. Not everyone is informed of the IDT meetings. Not everyone's included in the IDT meetings. So I just like to put that down as one of the issues that affects the host home, because IDT meetings are supposed to discuss residential placement, and very often they don't. And now we have case management redesign with case managers having 150 clients, and I don't think that's going to be an efficient route for a checks and balance. I did raise in the chat a little bit earlier about the possibility of perhaps creating some kind of an ombudsman, because right now the HCBS services are excluded from the long-term care ombudsman duties. And now we have overwhelmed case management agencies and case managers. And I'm worried that the IDT process will become even more diluted.
Victoria, I'm calling on names. I hope I'm not overstepping if you want to do it.
No, you're totally fine. I think we can take 1 to 2 questions as long as we stay to a minute for each, and then we'll need to go ahead and move on.
So I see Zachary and then Deanne.
Sure. I was just going to say that the Bar Association, that came up last week in our meeting, the concept of expanding the ombudsman role. So I think there's a lot of interest in doing that. And then with respect to the grievance procedure, I mean, even having something that would at least be comparable to what we see with residents' rights in nursing homes. I'm not saying that's a perfect system, but it's substantially more robust than what we have right now. And that's that low cost, very effective. Well, it's not going to solve all problems, but it's a very low cost way of advising people of what their rights are in grievance procedures.
Thanks. And then Deanne Major.
Yes, I just wanted to say that I think it's important that maybe one of the topics that we look at is, so to fund a system of penalizing PASAs that are not in compliance and therefore have host home providers that aren't in compliance. How do we fund that system, and how do we staff that system? And maybe looking at other states and what have they done? If they have a system of penalizing those bad actors through fees or fines. Because it may require a fiscal note or something, but just to be prepared for that.
Great, thank you. And Victoria, back to you.
Thank you. Meg, if we could pull up the presentation again. Thank you. And we'll go to, yes, logistics. So thank you, Peggy, for sharing all that information with us. And unfortunately, we're coming to the end of our time today. I do want to thank you all for all of your input and your feedback. Again, any questions or feedback that you have for us that we were not able to capture today, you are welcome to follow up with me or with Meg via email following this meeting. So quickly, we will go over the logistics for our future stakeholder meetings. We are looking to resume these meetings after the new year in January of 2024. The cadence for the meetings will likely be about 1 to every 2 months, and we will be preparing a schedule to send out to you all with the cadence of those meetings so that you remain informed. There will be an agenda posted onto our webpage prior to our meetings. I included the link to our webpage in the chat. It is on the HICPUF website under the Host Home Oversight Stakeholder Work Group. This is, again, where you're going to find updates, agendas, and recordings of our meetings. And as always, please continue to monitor our OCL newsletter for additional updates and meeting announcements. So next slide, please. So unfortunately, we only have about 4 minutes for questions, but I will go ahead and open the floor again and take a look who has their hand raised. Joshua, I believe you're first. Go ahead.
Thanks, Victoria. I just wanted to ask about some of those next steps that you had in that last slide. I'm hoping that you might be open to doing something like a listserv. Sometimes some of those meeting agendas and the cadence, the frequency can be lost, and sometimes very lengthy memos or notices that kind of are sent out. And I'd like to make sure that it's kind of public facing and helps get the stakeholders present at the meeting.
Sure, absolutely. Thank you so much for that feedback. And yes, thank you, Peggy, for throwing that into the chat as well. Are there any closing questions, closing feedback items that you all would like to present to us? Okay, if not, we'll go to the next slide. And again, thank you so much for your time and continuing participation regarding this project. Your feedback is incredibly valuable for the success of this project. Again, you are welcome to email me. I am Victoria Rogers. My email is listed here, as well as our HCBS inbox. Next slide. And thank you again, and we will see you all next time.
Sorry, I was trying to look through the chat. My comment was, I think there was a question about how it would be best to kind of keep people engaged. Maybe I got the question wrong, but yeah, that's what I meant. If there's something like a listserv where you can just include interested stakeholders in targeted email messaging, I think that would be helpful.
Absolutely. Thank you, Josh. I appreciate the clarification.
Yeah, thanks so much. We appreciate y'all.
Thanks. Have a good one.
You too. Take care. We'll see you in January.